Let's talk about Billy Porter. You know, Billy Porter, he is a Broadway star. He's now a director. He's a huge personality. Billy Porter is a lot of personality. Okay, you may have seen him recently when someone asked him what he thought about Nicki Minaj, and he gave some quite famous dramatic words. Well, now he's come to the front. He did an interview and he shared that he really almost passed away. In fact, he describes it that he passed away several times, meaning he likely coded, meaning he probably went to cardiac or pulmonary arrest. I'll let him tell it, and then we'll talk about it on the other end. All right, let's hear what Billy Porter says about his kidney disease situation.
There's news on 2017 GLAAD honoree Billy Porter getting emotional while reliving the sepsis battle that put him on life support.
I was dead for 3 days. I am a miracle. I'm a walking miracle.
It all started with a simple UTI last spring, which then led to a painful kidney stone infection by the fall. But then
I checked myself into the hospital because I'm in so much pain. Saw that the kidney stone was trapped. There was so much infection. I went uroseptic in minutes.
Billy had to drop out of cabaret on Broadway, revealing on the Outlaws podcast he also almost lost his leg.
They had to cut me open on either side of my leg while I was in a coma so they could save my leg.
You good now?
I'm good. Okay. I'm good. I'm getting there. Not 100% yet, but I'm getting there.
I love how he shares. Very good. In the chat, I want you to please put and give me a musical note. This is musical mind. He was doing cabaret. Give me a musical note, and I want you to tell me what you think some risk factors for a urinary tract infection are. He said that he had a UTI, urinary tract infection. I want you to tell me that. And then, in honor of Kidney Disease Awareness Month, I'm going to talk to you about kidney stones because he described having a kidney stone that was trapped and a UTI. And so we'll talk about what that connection is, okay? And so a kidney stone. So a kidney stone is when you have crystals that actually are in the urine and then they bind to each other to form a stone. It's like, it sounds like it's literally a rock in your kidneys. It's a kidney stone. And once you get a kidney stone, it can pass on its own, which is what you would hope for it to do. When it passes on its own, it can be quite painful as it scrapes down the inside walls of your kidney system. But if that kidney stone is too large to pass, then it can become trapped, the way that Billy Porter's became trapped. And when that happens, you can get a backup of urine. And when that urine is just sitting there, sedentary in your bladder or in your ureter or in your kidneys, then it can lead to a severe infection. And he described having all kinds of pus, okay? And his whole body became infected. And so what starts off in the urine as being a local urinary tract infection can spread to your whole body. And that's called sepsis when the infection gets into the bloodstream. And he had urosepsis or sepsis from a UTI. And it can really lead you to be severely ill because when you have sepsis, this infection, this overwhelming infection, it can cause your body's systems to go all out of whack. It can cause you to have a failure of your cardiovascular system, meaning that you can have a severe drop in blood pressure. You can go to septic shock, okay, requiring you sometimes to be on artificial medications, artificial drips through the IV to keep your blood pressure up. You can go into respiratory failure, okay, requiring mechanical ventilation, a breathing tube, okay. You can get kidney failure. You can have all kinds of issues, all starting from something as what seems to be as simple as a urine infection. And so how are these things related? Well, you wonder what came first, the chicken or the egg. There are different types of kidney stones. There's one type of stone called a struvite stone, and it often comes from people having repeated urinary tract infections. The most common stones are calcium oxalate stones. But then so you see the urinary tract infection can increase your risk for kidney stones, for a struvite stone. But then if you have a kidney stone that is blocking your urinary system, like what Billy Porter described, then that blockage can cause a UTI. So what came first, the chicken or the egg? They're related that way. And so I'm going to see what you all say as far as in answer to my question, and then we'll talk about kind of some signs and symptoms, how to recognize UTIs and kidney stones, and most importantly, when to contact your physician. Did anyone comment?
Yeah, absolutely, Dr. Frida. YouTube butterflies, blue butterflies.
Hi, blue butterflies. Thank you for joining us.
Dehydration.
So dehydration that can put you at risk for both. So as far as kidney stones, I mentioned that you have different crystals, okay, like different particles that have to meet each other to stick together to form a stone. Well, if you're very, very hydrated and you're drinking a lot of water, that means you have a good urine flow, and you might have a lot of particles in your urine. But if you're hydrated, it's hard for these floating particles to find each other, right? But if you're dehydrated, like what blue butterflies is saying, then if you're dehydrated, those particles become more concentrated and they can find each other and stick together. So being dehydrated is a huge risk for kidney stones. It can also be a risk for urinary tract infection because if you're dehydrated and the urine's just kind of sitting there, concentrated, sloshing up, and it has bacteria, they have more time to sit and multiply in your bladder if you don't have a good urine flow from hydration. So being dehydrated can put you at risk for kidney stones and UTIs. Come on to the front of the class. Thank you. Anyone else?
Yes, Ms. Aileen says poor hygiene.
Poor hygiene. So that's as far as the urinary tract infections. So if you, for example, have a lot of stool or soil and you don't change, you're not cleaning the stool off of your perineum. Okay, when I say perineum, I'm talking about your area of your genitalia, like your undercarriage, or the part of your body. If you were to sit on a saddle, the part that covers the saddle, that's your perineum, and that's like that area, your genital urinary area. So let's talk about women. So for women, you're dealing with the the vagina there, the urethra, which is the urine hole. You have the anus there, all of those things. If you are someone who does not have good hygiene, and if when you urinate, you wipe from back to front, where you're pulling what's going on at bowel movements up to where your urine tube is, the urethra, that could put you at high risk for urinary tract infections. That's correct. Men also, if you, especially for example, if you're an uncircumcised man and you don't pull back the foreskin, I hope I can say all this on YouTube. It's just science. It's just science, everybody. So if you have a lot of bacteria and it sits there and it collects at the urine hole, that urethra, then that could put you at a higher risk for urinary tract infection as well. Also, for someone who is, say, elderly in a nursing home, or someone who is not mobile, if they depend on other people to clean them, and they have, adults like Depends or adult diapers, if they're not changed frequently, and if they're just allowed to sit there in their own soil, okay, like their own bowel movements, then again, the bacteria from the bowel movement can crawl up into the urethra, the urine hole, and go into the bladder. Okay, so yes, having good hygiene is a way to help to prevent urinary tract infections. And just reviewing the anatomy, you have your two kidneys, they're like in your lower back where your flanks are, and then the tubes that connect the kidneys to the bladder are the ureters, and then you have the bladder right in the front, like when you feel like you're full and have to use the restroom, your bladder is full. But leading from the bladder to the outside world is a tube called the urethra. Of course, it's short in women, but in men, it has to go all the way through the male organ. So that's the urethra. When we talk about it, and again, Billy Porter said that his urethra had a blockage from a stone. Okay, anyone else? And then we'll just kind of get into how to prevent and when to talk to your doctor.
Yes, Purple Onion says
Purple Onion,
holding your urine for too long. So holding urine for too long.
Okay, so holding that urine, good, because that gets into you're creating your own blockage, right? If you're holding your urine for a long time and it's stagnant and it's sitting there, it's kind of like if you have water in a sink and you just leave it there for days and days and days and don't drain it, it can collect bacteria, it can collect whatever else is going on, and it doesn't flush through. So yeah, holding your urine really could increase your risk for urinary tract infection. Good. Okay. All right. So women tend to get more urinary tract infections than men, just because we have that short urethra, and it's easy for bacteria to get up there to the bladder. But men tend to get kidney stones more frequently than women. Haha, payback. At any rate, make sure that you stay well hydrated. You consult with your doctor. You maintain a low salt diet. Even though I mentioned that the most common kidney stones are calcium oxalate, you want to have a diet that has normal amounts of calcium. If you try to cut back the calcium in your diet, it sounds counterintuitive, like it doesn't make sense. But if you try to cut back the calcium in your diet, that can actually worsen your risk for kidney stones. But as far as calcium supplements, you do want to limit your calcium supplements. But as far as whole foods that have calcium, please don't cut those back. As far as preventing kidney stones, yes, stay very well hydrated and listen to your body. If you're having fever, if you're having blood in the urine, if you're having pain in your kidneys, if you're having pain in your bladder, please don't ignore it and don't say, oh, I'm too busy to be sick, because everyone's kind of too busy to be sick. And I know Billy Porter is working, booked and busy. He's too busy to be sick. But if you ignore those early symptoms, then you can end up passing away, okay, or in an ICU. So definitely pay attention to your body, and wishing Billy Porter the absolute best. And for just today, as we move on, well, for the rest of the month, this Kidney Disease Awareness Month, if you have a specific kidney question, just put an orange heart in the chat. We'll give members priority, of course, Super Chat's priority, and we'll see what we can get to as we go through the show. So give me an orange heart if you have a kidney question.